So I want to talk more about your field. One of your interests is preeclampsia, which is a complication of pregnancy. Do you want to talk more about what your findings have been and also the research on that current?
Yeah, so preeclampsia has definitely changed over several years, and again, as we said earlier in the podcast, medicine is always changing. That's why we're lifelong learners. I think a lot of people have lost confidence in the medical system recently because they see that medicine keeps changing, and so they assume that we don't know what we're talking about. But at the end of the day, the basic idea here is that we have to go off the research, and at least in our minds, it's better to go off what the current research says than to just take a guess. Now, yes, that research may change, but I think it's a good thing that we change as that research changes. That way, you're always getting the most up-to-date medicine, and sometimes that up-to-date medicine will conflict with what we previously told you. That doesn't mean you should lose confidence in us. If anything, you should support the fact that we're willing to continually be open-minded about the idea that our culture is changing, our eating habits are changing, our exposure to certain chemicals and things are changing. And as a result, sometimes recommendations will change. Cave women, when they delivered babies, presumably they didn't have as much access to food as we do. And as a result, they're not going to have larger babies and higher risks of diabetes and preeclampsia. So you have to understand that medicine can't be a one-size-fits-all, and that medicine will change over time. That being said, preeclampsia is not really the disease. Eclampsia is the disease, and eclampsia is essentially a seizure. Preeclampsia is a pre-disease. It was a set of risk factors that we could notice that helped us catch eclampsia early so that we could prevent people from having a seizure. And that risk factor essentially is that if you have high blood pressure or lab abnormalities, that would be a sign that you might be someone who's at risk for subsequently developing eclampsia. Nowadays, on the other hand, we're so good at capturing people in the preeclampsia phase. A lot of patients don't even know eclampsia exists unless they were fans of, Downton Abbey. And so now, again, being so good at capturing preeclampsia, we're starting to try to capture people in the pre-preeclampsia phase. What are those risk factors that people develop earlier than preeclampsia that tell us that they may be subsequently going on to or developing preeclampsia? And so that pre-preeclampsia is actually known as gestational hypertension, or mild preeclampsia or preeclampsia without severe features, lots of different names for the same thing, which essentially is a set of signs and symptoms that tell us that, you don't really have a disease, but you have a risk for developing that disease. And if we can catch it early enough, we can prevent it from progressing.
And what are some of those things people can look out for to prevent eclampsia? Obviously, known as preeclampsia before it happens.
Yeah. So again, eclampsia is a seizure. Preeclampsia is either lab abnormalities that show us that your internal organs are not happy with your blood pressure. So kidney damage, liver damage, breakdown of blood in your body, leading to lower blood and lower, blood clotting factors like platelets. And now in the elevated blood pressure above 160 systolic, which is the top number, or 110 diastolic, which is the bottom number, and not just on occasion, but something that's either persistent or has shown that there's a pattern, that it keeps coming back, versus, this pre-preeclampsia phase, again, gestational hypertension or preeclampsia without severe features, which is just a lower threshold. No lab abnormalities and blood pressures with 140 instead of 160 or 90 instead of 110. Again, just a little above normal, but not quite at that high enough level. And again, that tells us that, you're higher than normal, but you haven't gotten to that bad part yet. So maybe we still have some time to intervene, get you delivered before it's too late. And so people with preeclampsia get delivered at 34 weeks. People with eclampsia get delivered happens, and people with pre-preeclampsia get delivered at 30. Sorry, I've been up all night helping people deliver their babies. I'm just a little dry. But the basic idea here is that we're trying to intervene at the time that it happens and balance those benefits and risks. So if you have a riskier condition like preeclampsia, it actually benefits us to deliver you at an earlier gestational age, 34 weeks, because at that point, the risk to the mom outweighs the risk to the baby. Whereas if you only have pre-preeclampsia, we're not going to deliver you at that same time frame because, then the risk to the baby outweigh the risk to the mom. But if you're 37 weeks, you're full term, now it doesn't make sense to keep you pregnant any longer because we don't want the risk to the mom to continue to go up, knowing that the baby is full term and will do just fine. So these guidelines, again, are always continually changing. But the basic idea here is that we're trying to look for risk factors that will help us identify these symptoms that pre-exist the disease. Kind of, we call that the prodrome in medicine. These symptoms that are prodromal that tell us a disease is coming but hasn't come yet.
And what are some of these complications, if we can highlight that again, of pre-eclampsia?
Yeah, so the complications of preeclampsia essentially are that you can go on to develop eclampsia, but also that as your blood pressure gets higher, that pulsing, that strength of that pressure of the blood flowing through your system can actually damage, transiently, not something that's permanent, but can damage your internal organs, leading to liver damage or kidney damage, blood vessel damage that can destroy blood cells and cause anemia or higher levels of bleeding. And we want to try to avoid that because eventually those things can actually lead to harm for the mother or lead to harm for the baby. And so if we can capture it at an early enough stage and prevent it from getting any worse by delivering your baby, we can then help the baby not progress to a point where the baby can be harmed and also help the mother not progress to a point where maternal health can be harmed.
And what are some measures people can take to avoid the preeclampsia from developing?
Yeah. So, sadly, a lot of this is genetic. Separately, we don't actually know the cause of preeclampsia. We know it has something to do with the placenta because the placenta is a huge bed of blood vessels. And of course, your entire circulatory system is one continuous loop. So if any point of that system gets constricted or, blood flow is not quite as good, the rest of the system has a backup and the blood pressure will go up. So we know it has something to do with the placenta. We know it has something to do with the blood vessels. But with all of that being said, we don't know the exact cause or have any tests to really identify it earlier yet, although certain things are being researched. And so as a result, there's not a lot that parents can do to help avoid that. The biggest thing is, of course, to try to exercise and eat a healthy diet and, avoid high salt objects, not smoke cigarettes, do all the things that lower blood pressure outside of pregnancy. And those are called modifiable risk factors, essentially risk factors that you can modify, but there are a lot of non-modifiable risk factors too. And so it's important to get consistent prenatal care so that we can, as practitioners, try to identify those issues before they progress to a point where they can be harmful to the mother or the baby. And
also, just to highlight, because you actually sent me this paper to read, and it was interesting because around the world, compared to the US, the rates are much lower, and it's been increasing a lot in the US itself. It's since the last 10 years, in fact.
Yeah, and part of that is diagnosis. People might use different guidelines at different countries. And so, what we might call preeclampsia here is not called preeclampsia somewhere else. But also part of it, again, might be the environment. We live in a different location than other people. So what are we exposed to? Different levels of smog and poisons and gliadin and gluten in our bread versus things that aren't in the bread in other countries and the water in other countries. And of course, also the diet in our population. I think that I haven't, again, I'm an OBGYN, but I think the last statistic I had heard was that, at least 1/3 of the United States population has diabetes. And more than that, we're obese. And so all of those things are, again, modifiable risk factors that other countries might not necessarily have. But again, not knowing the cause of preeclampsia, I'm sure there are other things that they might be exposed to in our country that other countries don't have. And so at least what we can do is try to modify the risk factors we can, making sure that people are healthy, come into pregnancy at a healthy, eat a healthy diet, avoid things like smoking cigarettes, etc.